stomach cannot empty into the duodenum and they are vomiting. And lastly, bilious vomiting. If the vomiting contains bile, the stomach is normal, esophagus is normal. The problem is in a duodenum distal to the D2. There is D3, D4 or jejunal problem. That's why there is a vomitus containing bile. Order of the vomiting is a fecal order, the fecal order in a vomiting. Then you are dealing with intestinal obstruction or gastrocolic fistula or gangrene of the intestine or long-standing gastric outlet obstruction. That means CS stomach for at least 3 to 6 months duration, and this person will have fecal vomiting. Other symptoms: if you have fever, your weight loss, your jaundice, your chest pain, your headache, or your past history of abdominal surgery, then this is not a functional vomiting. This is not psychogenic vomiting. You have to make sure that you rule out organic causes. So any vomiting with fever, or a weight loss, or a jaundice, or a chest pain, or a headache, you have to rule out organic causes. What are the complications of vomiting? What happens if let a person continue vomiting? Psychogenic person is vomiting. Let him continue vomiting. Let her continue vomiting. What happens? Nothing happens. No. If you vomit continuously, sometimes you can aspirate, especially in an elderly person or a children or person who vomits in a supine position can aspirate an aspiration pneumonia. It's very difficult to treat. Person can get dehydrated over a period of time. There can be electrolyte imbalance like a hypokalemia or hyponatremia. There can be loss of hydrogen, acid from the stomach, so metabolic alkalosis occurs. And because of the hypokalemia, again the H ion shift occurs and that person can have metabolic complications. Then person can have an injury to the esophagus and stomach. Mallory-Weiss syndrome, or what is called as a Borhaus syndrome. This Borhaus syndrome, there are two ways of getting Borhaus syndrome. One is a spontaneous rupture of the esophagus, or due to retching you get a esophageal rupture. Spontaneous rupture in a younger patient, you can get a transmural rupture of the esophagus. Esophagus can rupture through and through, and you can put all the gastric content into the mediastinum and the lung. Or if I do endoscopy, my endoscopy directly enter the chest, thorax, and I can see heart and aorta very clearly. And I've done endoscopy many times in Borhaus syndrome. And when you see this, it's a very painful and very difficult treatment. It's a long-term hospitalization, 3 months in the hospital. And you can have a dental disease, dental caries, dental problem, and dental involvement. And you can have a mask phenomenon, purpura over the face. The person is retching, the raised intrathoracic pressure, and you can get a retching and a purpura on the face. You get it. Medical side, treatment, from diagnosis, you identify the etiology, treat the etiology, primary cause, and vomiting subsides. You treat dehydrations, treat the metabolic complications, there's hyponatremia, hypokalemia, and metabolic alkalosis. In a very few cases, less than 10% of cases require hospitalizations. You have to keep nil by mouth, IV fluids, and parenteral drugs. What I do for my psychogenic vomiting, not responding to the medical treatment, young person, boy or a girl, vomiting continuously, entire family very upset, and especially if they are from the Pedder Road side or a Malabar Hill side, then they want entire world to sleep. Dr. Saab, neurologist, call this person. Then best treatment that time for this vomiting to stop immediately, which is D treatment, pass Rice tube. Moment you pass Rice tube in a functional case is the vomiting stops immediately. And first is, doctor, please remove this tube from my nose. And you quietly tell that girl or a boy, I will remove it provided you stop vomiting. Quietly tell her, I know why you are vomiting, so please stop vomiting, I can remove this. And immediately vomiting stops next day. But sometimes, the condition, psychogenic conditions, person can continue vomiting and they can die. And I have few young girls dying under me. 3 months in hospital, that girl refused to eat food and continues vomiting every day. We called everyone and she had a severe psychiatric problem and she died. So you have to be very careful here. And the parenteral drugs. Parenteral drugs, what we have is nothing but we give now ondansetron, drug is drug of choice at present. Then we have antihistaminics we give for the vestibular problem. For motion sickness we have anticholinergics we have. And we can give pantoprazole and we can give phenargan. Now, to summarize what we have discussed in vomiting in 2 or 3 slides. So when you have a person with a severe nausea vomiting, first thing, if the female patients in a childbearing age group, make sure that the lady is not pregnant because you are going to give certain drugs which are contraindicated in pregnancy, so you can't give that. Then rule out CNS disorders, because this is going to trouble you and going to create problem for you in the practice. So rule out CNS disorders. In spite of my teaching, in spite of doing this, in last 3 or 4 years, I still missed 1 or 2 cases where there was a CNS problem and I could not diagnose. There was one hospital clerk, her brother, 4 years back in Bhatia, came to me, so my brother is vomiting continuously. Please do endoscopy. Straight came for the endoscopy. I did endoscopy. After endoscopy normal. What happens? After when I eat food, no, I just vomit, I don't know, I said, do you have any stress? Yeah, I lost a lot of money in the business. So the moment I said that, you get slightly diverted to the functional causes. So he came to me once or twice. I changed my treatment 2-3 times. And after about 3 months, again that clerk met me. So my brother got operated, he's better now. I said, operated for what? No, sir, he had a large meningioma in the brain. He became unconscious 15 days back. So we got a CT scan done and it turned out to be meningioma. Operated is better now. Thank you, doctor. I did not know whether to take thanks or not because I missed the diagnosis. So idea is keep your mind open for the CNS disorder when you do not have answer in a clinical examinations. Then oncology, malignancy you must rule out. Evaluate. First thing I always tell, if the person vomits on my treatment, I go to my drug list. I find out there's something in my medicine list which is producing vomiting. Then localize abdominal pathology and abdominal pain. And then you see what the food contains, the vomiters. You see hematemesis and then divide into acute or chronic. Acute vomiting, patient not toxic, patient not dehydrated, probably gastritis or gastroenteritis. Give clear liquids, antiemetic drug from my side. Symptoms stops. But if symptoms continue, work up for the chronic vomiting. The person was actually having a chronic vomiting, presented acutely. If the person is febrile and dehydrated, start IV fluids. Find out the plain X-ray abdomen, there's air fluid level, obstruction or no obstruction. Find out any gastric outlet obstruction, malignancy. If you find no obstruction, continue your treatment. If the vomiting does not stop, work up for the chronic vomiting. Or if you find obstruction, refer to a surgeon and try to rule out the surgical causes. Chronic vomiting, on waking up, we discuss alcoholic gastritis, pregnancy, intracranial tumor. After eating, gastric ulcer or gastric malignancies or duodenal ulcer. And sometime after eating food, 3 hours after eating food, gastric outlet obstruction, or you can have small bowel obstructions. So you can do barium studies or endoscopy. If you find some structural problem, treat that, surgical treatment. If there is any gastroparesis, treatment of the gastroparesis. And if you find endoscopy in barium is normal, go outside your GI tract, find out from the outside GI tract whether there is any small bowel pathology or large bowel pathology, or there is a psychosomatic disorders. Psychosomatic disorders, you have to find out and treat that. So that will take care of the vomiting in your clinical practice, and that's the approach to vomiting.